Why is weighing yourself every day important? Weighing yourself every day can help identify if you're retaining fluid. If you have heart failure, fluid can build up in the body due to eating too much salt or drinking too much liquid. When a patient has heart failure, the heart doesn't pump as effectively as it should. When the heart doesn't work as well as it used to, fluid can back up and settle in the lungs or in the feet, ankles, legs, or abdomen. Weighing yourself every day can help you monitor your symptoms and help keep you out of the hospital. Let's discuss how you should weigh yourself. Weigh yourself when you first wake up in the morning, after you've used the restroom, and before eating breakfast and getting dressed. Placing your scale in the bathroom can be convenient and can serve as a reminder to take your weight after using the restroom. As soon as you have your weight, write it down. This can help track your fluid status. You don't need a fancy scale. Any scale that you have will be fine as long as you use the same scale every day. If you notice that your weight has increased 2 pounds from the day before or 5 pounds in the last 7 days, then it is time to call your doctor. Adjustments might be made to your diuretic, also known as a water pill, so that the fluid can be taken off. This simple step can help keep you out of the hospital. It may not seem like 2 pounds is a big deal, but 2 pounds is the equivalent of a 1-liter bottle of fluid, and gaining 5 pounds of fluid in a week is a little more than a 2-liter bottle. This amount is enough to cause an admission to the hospital. After you weigh yourself, ask yourself a couple of questions. How am I feeling today? Am I feeling more tired than usual? Am I having more trouble sleeping? You could be tired and feeling depressed because you have too much fluid. Keeping a log of your daily weights can be a simple and easy way to determine if your condition is getting worse. Am I having more trouble breathing than normal? Am I having more difficulty breathing while walking or lying in bed? Do I have more swelling in my feet, ankles, or abdomen? Am I using more pillows while sleeping? If you answer yes, you may be gaining fluid weight, and it is important for you to call your doctor. Your doctor might make adjustments to your treatment plan to help take the fluid off. Weighing yourself every day is a simple step that can help keep you out of the hospital. After you have your weights and you know how you're feeling, have a plan of action. What do you do with the information? First, look at your weight log. Is the number about the same? If you weigh the same and you feel the same as you did yesterday, everything is fine. You don't need to do anything else. Continue to weigh yourself every day and check your symptoms. Is the number from today different than yesterday? If so, by how much? If it is 2 or more pounds higher, then call your doctor, especially if you have more swelling and more difficulty breathing. When in doubt, make the call. Call your doctor as soon as possible. Now it's time to test your knowledge. Question 1. Ashley woke up with some shortness of breath, which is not usual for her. She also noticed that her ankles looked bigger than normal. Her weight today is 1 pound higher than yesterday, but she looked at her weight log and noticed that her weight is 6 pounds more than last week. What should Ashley do? Answer. Ashley should call her doctor or healthcare team to let them know her weight and discuss her difficulty breathing and increased swelling. They might adjust her diuretic dose so that she can excrete the excess fluid. This will keep her at home with her family and avoid an admission to the hospital. Question 2. Jerry weighed himself this morning, and his weight is the same today as it was yesterday. He also noticed that it is the same as last week. He is not having any difficulty breathing, and he has no swelling. What should Jerry do? Answer. Jerry does not have to do anything different at this time. Jerry should continue weighing himself every day and watch for changes in weight and shortness of breath, as well as swelling and fatigue. Question 3. Michael ate some fried chicken and 2 pieces of pie at the family reunion yesterday. Today he weighs himself and his weight has increased 3 pounds from yesterday. He is not experiencing any shortness of breath or swelling. His energy level is the same. What should Michael do? Answer. Michael should go ahead and call his physician. His weight gain may not be related to fluid retention. Michael does not have any symptoms of worsening heart failure, so his treatment plan will probably be the same, but this will alert the healthcare team to the weight gain. They can continue to work with Michael to monitor his health. Let's recap. Weigh yourself every day when you first wake up in the morning, after you use the restroom, and before you eat or drink. Watch your salt and fluid intake. Monitor your breathing, fatigue, and swelling. If you notice your weight increasing by 2 or more pounds in a day, or by 5 or more pounds in a week, if you notice an increase in shortness of breath, an increase in swelling of the feet, ankles, legs, or abdomen, and increased fatigue or trouble sleeping, call your doctor. Once you have heart failure, you always have heart failure. So managing symptoms is an important step in staying out of the hospital and remaining as healthy as possible.